the American people are sick and tired of the greed of the pharmaceutical industry.
Bernie Sanders and the progressive side of the Democratic Party have been pushing lately all across the country as we ramp up to the elections for a Medicare for all, a single-payer system. And, you know, I don't think that's really politically too likely in the U.S. right now. But, you know, there's another thing that we could do that's an important big step that is within, I think, political reach. And that would be to have our own federal government, the biggest purchaser of drugs in the world, actually be able to negotiate with pharmaceutical companies to get better prices. Now, that's what happens in every other country in the world. And by the way, that's what happens with our own Veterans Administration and our military in this country. They negotiate. So why can't Medicare Part D do that? Well, because our Congress is very, very nice to the pharmaceutical industry. And look, the pharmaceutical industry is a creative, wonderful part of our economy and the innovation in this country. I'm not anti-pharmaceutical industry, but it is one of the most profitable industries in the country, and it gets all kinds of special favors from the federal government. Federal government allows the pharmaceutical industry now to have extra 5 years beyond patent life for certain drugs in the marketplace. That's powerful, you know? That means no generic in that space. Special market exclusivity we give to certain drugs and certain companies in certain situations. Once again, the FDA then can't put a generic in place of a drug because of these special privileges. So we give special privileges to the pharmaceutical industry. And look, they're charging 1/3 as much in places like London and Paris and Berlin. These are, you know, expensive places, just like the United States. So why are we letting that benefit go there and not here? What should the federal government do? And let me just give you a kind of a quick background on one of my roles in life today is being chairman of the National Coalition on Healthcare in Washington, the oldest, largest coalition on health policy. It's got 150 million Americans if you put all the organizations it represents together, groups like AARP and the labor unions, the big business coalitions, professional societies, consumer groups, and so on. You know what? That whole organization now thinks pharmaceutical costs are the #1 priority, getting them down. Our own President Trump campaigned around the country saying this was something he was going to do, right? He's not doing it. So look, we all, as physicians and clinicians in healthcare, we need to talk to our patients, talk to each other, because there is something we can do here. I think the board of the National Coalition isn't much different from all of us. We can get pharmaceutical prices down by asking the federal government to take a bigger role. First, as the biggest purchaser, it ought to get the best price. Second, it can use leverage to stop excessive profiteering in monopoly environments, and it should. You know, when a drug like the rarely used drug Daraprim for toxoplasmosis goes from $13 to $750 in a year, that's excessive profiteering. We could do something about that kind of excessive. When EpiPens went through the roof, we could do something about that kind of thing. But a most important single thing is this: let Part D Medicare, CMS, negotiate with the pharmaceutical industry for fair prices, and we could get a 20%, probably $20 billion reduction in costs from that. We'd get rid of the, you know, the notorious donut hole in the Medicare Part D, and, you know, we would get drug prices down for our patients. Now, look, we're faced as doctors in a value-based healthcare system. We're supposed to be getting better outcomes at lower costs, right? That's what we're all expected to do as clinicians. We're worried because our own patients are not taking their meds. And adherence is a complicated matter, but a very significant part of adherence is the cost of drugs for our patients. So let's let Medicare do everybody a favor, save $20 billion, get rid of the donut hole, cut the drug prices for senior citizens, improve adherence, and let's make that happen for people. Remember this, like, we're spending $500 billion a year on pharmaceutical costs, and they're going up all the time. And there are a lot of wonderful things happening as a result of what's happening in innovation. But this is not because of the production costs of drugs that pharma can't lower prices. It's not that. The actual production cost is up 10% of the selling price. It's not because of R&D. It's because You know, R&D is a smaller amount of money than pharmaceutical industry spends on advertising to people like you and me, and advertising direct to consumers. It's really about something else. It's just about a fair marketplace, and pharma has a special privileged place in the U.S. market. It's time really to take this not so bold move, but very, very real move, and let Medicare and CMS negotiate for drug prices and get the cost down. Thank you very much.